do IPL today. IPL stands for Intense Pulse Light. It's a great treatment for both red and brown, meaning brown, freckles, or sunspots. This is not the treatment I primarily use for melasma, which is more patchy brown. For that, I typically use chemical peels. This IPL is on a platform, so this device actually has our IPL. It also houses our laser hair removal, and then we have a radio frequency microneedling device. So for today, we're going to use our IPL for redness. We've already done pulse dye laser to the broken capillaries around the nose, because sometimes the IPL can't fit into those very tiny spaces. So you can go ahead and do the pulse dye laser, and then come right next door, same day, and do the IPL. So first, I always check to make sure that the tip is chilled. This is a chilled sapphire tip. We've wiped the topical numbing gel off and applied ultrasound gel that helps couple the laser to the skin. So even though her eyes are covered, she'll still notice a very bright flash of light. So I'll start over here. 1, 2, 3. Okay. And then I'll just slowly go in a vertical and horizontal pattern. Routinely check the skin just to make sure that I see a response. It should be very light pink, but not too red. This should not be painful. If this is too stinging, I listen to the patient and I will turn it down. And then I'll change directions just to make sure I cover the entire area evenly. IPL, you just want to make sure that you are not tan when you come in for treatment. So if you have been away in strong sun and you do get tan by accident, just push back your appointment until your tan has faded. You also want to avoid direct sun exposure for about a week after the treatment. There's no broken skin from the treatment, so you can apply makeup later that day or certainly the next day if necessary. Go on the nose, on the chin. You want to make sure that you avoid any areas around the hairline or eyebrow hair. Okay, so I've done there. Now I'm going to go ahead and do a little bit on the forehead. Again, staying far away from the hairline. So as long as we're doing laser on the patient's face, we have the patient wear these types of goggles. Sometimes if we're doing laser elsewhere on their body, we will have them use these type. If it's on the face, definitely you need to use the opaque goggles. It's important to have the correct goggles for every laser. It is not the same pair. The wavelength of light that the goggles will cover is on the lens of the goggles, so you have to make sure that you have the correct one. And that everybody in the room is wearing them. Even if somebody comes with a spouse or a friend, to make sure that they're wearing the appropriate eye protection during the treatment. We also keep the treatment door closed to make sure nobody is walking by. You can do IPL on the same day as other treatments. We talked about pulse dye laser, but you can also do it on the same day as you do injectable treatments like filler or Botox. How are you feeling? all done.